started. Welcome to another Zoom call. Just a reminder for anybody listening that is new, please use the members only site to see all announcements. You'll see what's new, anything that's new. Nothing's been new really updated this week, except I'm adding blogs. So I'm adding links to new blogs when they're appropriate or semi-appropriate for you guys. So you'll see that on the homepage, links to different blogs. There's a immune system, there's a gut health blog with some protocols for different things too. So make sure you look at that. You can always access the blogs by looking at this little magnifying glass thingamajiggy and click any subject you want. Let's jump to the questions. What are your thoughts about using soy in the diet for somebody who has had an estrogen-driven cancer? Well, I'm not a fan of using soy in the diet, even if you don't have an estrogen-driven cancer. We are exposed to way too many xenoestrogens as it is. And soy isoflavonoids have different are estrogen stimulators and estrogen mimics. So I'm not a fan of that at all. Even if it's organic, 95% of the soy grown in the United States and Canada is GMO soy, which is horrible for you. Even if you have the ability to get organic, non-cross-contaminated soy, it still has too many estrogen stimulators in it. It's just not a good food. It's just not anymore. It's just, unfortunately, because of our exposure to other xenoestrogens, it's, we cannot handle purposefully consuming them. So nobody should really be eating soy, or very little of it, at least. So you identified my husband as having significant mycotoxins. So what are mycotoxins? Mycotoxins are toxins from mold. So does the current programs you have him to run each evening include addressing these mycotoxins, or should his weekly program be updated or run additional programs to deal with the mycotoxins? Your insight would be appreciated. So two things can take place if you're dealing with mycotoxins. You can so understand, a mycotoxin is not a living organism of mold anymore. It's a toxin that a mold produced. So all these different types of mold can produce toxins. So you could have a sensitivity to the organism, the mold itself. That's typically an immune reaction to the mold. So that's what's called an IgE reaction. So you go into a moldy building and you start coughing, or you go, oh my gosh, I just can't handle this moldy building. I got to get out of here. That's a sensitivity to the mold organism. So that's what you could run the Rife for, to help kill any mold organisms. But a mycotoxin is a toxin that the mold produced. So it's not a living organism. So there's really not Rife programs to do, because remember, the Rife works best on killing things. So you could run mold programs on the Rife, but that's really for, when you have current exposure to mold. It will help kill mold in the house. It will help kill mold organisms in your body, but it won't kill mycotoxins, because mycotoxins aren't living. So you have to detoxify mycotoxins. You have to chelate mycotoxins. So you have to use different nutrients that will grab onto mycotoxins and pull them out of your body. So a mycotoxin is not a sensitivity. Mycotoxins are poisonous to everybody. So it has nothing to do with your genetics. Mycotoxins are toxins, they're poisons. They're non-organic, non-living they're not organisms, they're poisons, they're chemical poisons that a mold will produce. So you're not really running the rife to kill mycotoxins because mycotoxins aren't living. I've kind of drowned at that point. You have to chelate those out. You have to grab onto those. You have to use that diet. You have to use different detox, supporting all your detox pathways to get rid of mycotoxins. So there's not really a change in programming. The only thing that I would say that could benefit you with the rife with mycotoxins is running liver programs to help with detox, but there's that is already in each of your night program. I put those in there, or running the Ion Foot Bath, the Ion Pro Wave. So Ion Pro Wave programs will help pull things out of your body. I mean, they're mainly intended to get the higher frequencies in you, but they're certainly like the Clearline Detox Ion Pro Wave program will help detox out your body. Other ways to get rid of mycotoxins are with homeopaths, with different chelators, like I said, supporting all your 7 phases of detoxification, using the sauna, doing coffee enemas. Any way you think about getting rid of like a heavy metal or getting rid of glyphosates or getting rid of poisons in your body or different toxins is how you get rid of mycotoxins. So mycotoxins, when you do a mycotox test by Mosaic Labs, you do that, it's measuring the toxins from past exposure, or it could be current exposure, but it's typically past exposure. But you do have to look at current exposure. That's why it's good to get your house tested. Do we live in a moldy environment? And but many times people will go, yeah, I remember I worked in a really moldy environment several years ago. Well, that could be what was the exposure. If a patient has Epstein-Barr virus and heavy metals in the past and currently has cancer, should the test for Epstein-Barr and heavy metals be run? Maybe. So Epstein-Barr virus, understand the tests for Epstein-Barr viruses. So if you're going to run an Epstein-Barr virus test, you have to run a test that tests for, let me type this in here so you guys can understand this. You have to test for IgG antibodies and for IgM antibodies. So IgG antibodies test for past exposure. So if you look at past Epstein-Barr virus test and it showed high IgG antibodies, that just means you had exposure to Epstein-Barr in the past. You could have had it as a child, and you have no current Epstein-Barr virus, but you still have antibodies for Epstein-Barr virus. That's a good thing. You want antibodies for different viruses and bacteria. But that says that you were exposed to it in the past. You shouldn't be treating it if you have elevated IgG antibodies. If you have IgM antibodies, that means you have a current infection of Epstein-Barr or anything. So if you're testing anything and you're testing an antibody test for something, IgG antibodies tell you that you had exposure to it in the past. It doesn't tell you how bad that exposure was. It doesn't tell you that you were really sick from it in the past. You could have just been exposed to it, never got sick, and developed antibodies. That does not mean you're sick now, and it does not mean that you need to treat it if you have IgG antibodies. If you have IgM antibodies, well, then you should treat for that. Then you should run the rife. Then you should, treat it nutritionally. Then you should, depending on what diseases, if it's a bacterial infection or whatever, maybe use antibiotics. And then you should treat an active infection. This is past infection. This is an active infection. And it's many times different doctors will run an Epstein-Barr virus test in particular and see high elevated IgG antibodies, say, well, you have Epstein-Barr, we need to treat it. That's just not true. So you want to look at that. Can you run these tests? I think it's valuable to run any tests. I think all tests are valuable. It just, so we should have a discussion about this. Heavy metals, everybody's going to have elevated heavy metals. And some people are going to have more deleterious effects of heavy metal exposure. Some people are going to have increased heavy metal exposure and overwhelm their detox pathways. With everything, you're just trying to start slow. You got to go back to the 7 phases of detox. You got to walk through 6, 5, 4, 3, 2, 1 before you start pulling stuff out of the tissues too quickly. So I don't like doing everything all at once. We want to kind of clear out the body, get this person doing coffee enemas, get this person detoxing, get them using the Rife, and then we can have a discussion of, okay, what's a deeper step we could go? That's why I created all those courses, so you could continue to go deeper with your health. Do I have an autoimmune disease? Is that what's hindering my immune response's ability to kill my cancer? Should I deal with that? Do I have heavy metals? Do I have other things that I need to deal with that taking me to that deeper level now, it's going to improve my health. So I'm all for running these tests. The problem with heavy metal testing, just a side note of this, so heavy metal testing is difficult. So you could do hair analysis for heavy metal testing. It's not particularly accurate. It doesn't tell us where we're at right now. If you had heavy metals in your blood, that would just mean you have an acute heavy metal toxicity. That should be run in the hospital if this person gets some like stroke-like symptoms after a possible exposure of arsenic. They'll run a blood heavy metal test, and then they will do IV chelation, hopefully right away, to try to chelate that out of their blood. If you've had heavy metal exposure over time, it's not going to stay in the blood and it's going to be in the tissue. So blood testing for heavy metal really doesn't make any sense from a functional test. And then there is what's called a push test. And the push test is where you take excess chelating agents like DMSA and EDTA, which will pull a lot of heavy metals out of the tissues, and then you do a 24-hour urine test. So it's a push 24-hour urine test to test for heavy metals. And that's the most accurate way to see how much heavy metals you have in the tissues. The problem is it's really not good to do health-wise. It's a horrible health test as far as it'll detect whether you have heavy metals. It'll satisfy your curiosity whether you do, but it could make you really super sick. So I do not ever recommend doing the provocation test. And that's what a lot of functional medicine doctors do, is you could really make a person really sick. The truth is that we are all exposed to heavy metals, and you don't really, in my opinion, you don't really need to test for them, because if you're supporting all the phases of detoxification, you will be pulling these things out. So there are some better tests to run for other things other than heavy metals. There's a really good test by Mosaic, but it's on hold right now till I think the end of because they're updating the test at the end of July. It's supposed to, or first part of August, is supposed to be up and running again. And that's going to test for like 150 different toxins. And that's when I'm excited when that one comes out. Right now, I really like the glyphosate test, and there's several other tests that they have that I like for testing toxicity. And again, throughout the years of taking care of people from a functional medicine perspective, it's always really good to look at tests, because it gives a person some motivation to move forward. Most of my cancer patients don't need motivation when I say I want you to take this chelator or whatever, because it comes up in kinesiology testing. They don't need something on paper, black and white, to be motivated to do it. So I don't typically have to resort to running all these different labs, because they get to be pricey, when we could just treat as if, because we know we have heavy metals we have to detoxify, we know we have these things. I like to get somewhat of a picture as much as we possibly can, but and I do recommend hair analysis sometimes. Sometimes it's good, it's nice for a patient to see. I'll just tell you, it's just not all that accurate. So that's the only thing I don't like about that. So heavy metal testing is kind of, you know, hair analysis is not very accurate. Blood is not going to show it all. The push test is just not good at all health-wise. So we kind of have to resort to kinesiology or just assumption that we all have heavy metals that we have to deal with. And you certainly can't do chelation therapy, heavy chelation therapy if you have a metal in your mouth, mercury fillings and such. So you're limited to what you can do with that. But the Epstein-Barr and the other different latent virus tests, you want to make sure you run a test that does IgG and IgM. The ones that we have that I put in Rupa do both of those. So, but if you are going to see a local functional medicine doctor concurrently with what you're doing, it might be good to pass by me what tests that doctor wants to run, just so you're not running something that's kind of frivolous. Recently, you mentioned that sodium bicarbonate enemas may stimulate the parasympathetic nervous system also, which is great. While I'm doing 3 or 4 of these a week as part of my protocol, do you still recommend coffee enemas too? So this person is doing enemas with sodium bicarbonate instead of coffee. So this person has colon cancer, and the purpose of doing sodium bicarbonate enemas is that they're trying to get the sodium bicarbonate up to the cancer itself so that the sodium bicarbonate can break up the slime layer around the cancer, because that is acidic, and allow his immune system to be able to attack it a little better. That's the idea of that. The idea of coffee enemas has nothing to do with what I just said. The purpose of a coffee enema is to stimulate the vagal nerve down at the rectal area of your colon. The vagal nerve is what is responsible for a parasympathetic response. So if you're new to understanding what that is, go back and look at this blog and search parasympathetic or sympathetic, and you will see a blog post and a video that comes up to explain what the difference between parasympathetic and sympathetic is. We want to stimulate the parasympathetics because we live in a world of sympathetic overdrive, meaning that we're in a fight or flight, very high stress world, especially when we have a serious diagnosis. Our body has this constant inner angst that you can only combat from a neurological perspective by stimulating the parasympathetics and calming the sympathetics. In that blog post, I also have written a paper on things to do to calm your sympathetics. The sympathetics are governed by a part of the brain called the mesencephalic center of the midbrain. That's why it says the mesencephalic calming exercises. And then the parasympathetics are controlled by the vagal nerve. So those are called vagal stimulating exercises. The vagus is also cranial nerve 10. So you want to stimulate the parasympathetics and calm the sympathetics. You could do those concurrently. There's a bunch of different exercises that you could do that with. One of the best things for that is coffee enemas. Coffee enemas stimulate that vagal nerve. Sodium bicarbonate or chamomile enemas will do that also, maybe to a little lesser degree. So the question is, should I still do coffee enemas on maybe 2-3 days a week on the opposing days that you're not doing the sodium bicarbonate enemas? You certainly can. Yep, absolutely. So there's nothing wrong with doing that as long as the coffee isn't irritating the tumor itself. And we talked a little bit about that, but I don't think it really was in your case. Okay, that was all the questions we had come in. Is it possible to receive a frequency of renal cell carcinoma using the bulb as a separate 1 or 2-hour program? So you're asking, can you request from me for me to give you a 2-hour program of renal cell carcinoma, even if you don't have, or a different cancer, even if you don't have that cancer? Yes, you can. So just to fill out, go back to the member site. You can fill out the cheek swab request form, because that's cheek swab Rife request / Rife change request form, and send that in. So I'll know to do that, and there'll be the same fee for the cheek swab test. And I can send it out on a flash drive. Sure. When we last talked, you recommended Clear Digest when I read the recent blog about H. pylori. In it, you talk about testing with apple cider vinegar. Okay, so let's do this. Let's go to that blog and I'll pull that up. Okey-dokey. So the blog post is this one. Oh, hold on a second. Oh. All right, so I'm going to try to change my share. Share, new share. Okay, so everybody can see this new share now. Yes, you can see can everybody see the blog post here? Yes, somebody type yes. If you can see it. Okay, so here's the article, the blog post. Helicobacter pylori information and care. H. pylori, most common bacterial infection worldwide. Explains a little bit what H. pylori does to our body. Kind of important, H. pylori suppresses the parietal cells. The parietal cells are the cells in the stomach that are responsible for making HCl. HCl, and I think on this video down here, I put this video on there. This is a video I made about 10 years ago on how H. pylori is made, and I didn't even listen to the video. But I think this is my video that explains that in the process of making H. pylori, when your parietal cells make H. pylori, the byproduct is hydrogen is sodium bicarbonate, and sodium bicarbonate then acts as a buffer in the blood. And remember, I said your blood is constantly buffered, and your body is constantly buffered. If your blood doesn't need the sodium bicarbonate, it pushes it to the tissue. So actually, making HCl can help alkalize your tissue. And deficiency in HCl, a deficiency in your parietal cells' ability to make HCl, is probably the #1 health physiological malhealth on the planet, period. And which can explain one reason why we have more acidic tissue than we probably should. So HCl is super important in our body. So adding HCl to a meal is really important because that takes pressure off the parietal cells and it allows them to start producing HCl again. So when you add HCl to a meal, it doesn't have a negative feedback loop like adding a hormone to your body would, shutting down the gland that's making the hormone. It doesn't shut down the parietal cells of making HCl. It stimulates them even more because it takes pressure off of them, so it allows them to recover so that they can start making HCl. And by making HCl, it'll also produce sodium bicarbonate for the tissues to help alkalize you. Should make a video on that. So a decreased HCl causes iron issues, so it could cause anemia issues, can cause osteoporosis, can cause SIBO, which is small intestinal bacterial overgrowth. It decreases our microbiome diversity, which is a huge thing that leads to leaky gut issue. It causes systemically, it gets into the bloodstream and causes damage of vascular endothelial cells. It damages the endothelial cells and the smooth muscle underneath the endothelial cells, and is one of the top 5 reasons for cardiovascular disease worldwide. It is the #1 cause of stomach cancer worldwide. It's a molecular mimic to different antibodies in your body. H. pylori is. It can cause an autoimmune attack on the parietal cells, the stomach cells. It can be the cause of type 1 diabetes. It can be, like I said, the cause of cardiovascular disease. I've seen H. pylori cause major rashes in people's skin, just the list goes on what H. pylori can cause, and it's all because of decreased HCl production. This is a loop here. So a decreased HCl sets up H. pylori. H. pylori increases a loss of HCl. So it's really important to be taking a digestive enzyme with HCl. That's why we private label the Clear Digest, because it has HCl and a good slew of digestive enzymes. So you need digestive enzymes to help break down different things, protein, fats, and amylase to break down carbohydrates. Those are mainly made in your pancreas, though you make some in the parietal cells, or in the parotid gland as well, but mainly made in the pancreas and secreted in the duodenum. HCl is made by the parietal cells of the stomach and secreted into the stomach. And when you have a decreased HCl, it is a major issue. So it's a good article to read. But sometimes people have such a decrease in HCl that when they take Clear Digest with HCl in it, it causes burning, a stomach ache, and they can't even take it. Well, then you know this person has very severe HCl deficiency, and they may have to start with this little protocol. So this little protocol is take 1 to 2 tablespoons of apple cider vinegar with each meal. If that causes burning too, so if taking HCl with digestive enzymes causes burning, okay, well, you've got major stomach issues, quite possibly a stomach ulcer. If taking 1 to 2 tablespoons of apple cider vinegar with each meal, oh my gosh, I can't tolerate that either. My stomach is killing me. Typically, this is a person that's taking a PPI like Prilosec or something like that. We're trying to get them off of Prilosec. And if this is causing burning, then we have to go and work on healing the gastric lining, which is like using, deglycerized licorice and, different things that will help just heal up the stomach lining. We have to do that for a couple of weeks to a month. But most of you, I haven't had anybody that's been this bad for quite a while that couldn't even tolerate apple cider vinegar. But you could just follow this chart. So if this is you, so the person who asked this question, let's go back to the question. You talk about testing with apple cider vinegar. A few years ago, I was taking apple cider vinegar and developed terrible pain and burning. I had to go on Prilosec to get better. So a Prilosec will really decrease your symptoms, but you do not want to go on Prilosec unless your life depended upon it. We got to heal up the stomach using things like slippery elm, and there's different herbs and marshmallow and different things like that that will help heal the stomach. So if you take HCl and you get burning, if you take apple cider vinegar and you get burning, it's a sign that you have really damaged mucosal lining of the stomach and possibly the duodenum and possibly the lower part of the esophagus, and high possibility of an ulcer. So we have to heal that first. So, and you might have to go on an antibiotic for a period of time to kill the H. pylori, also to knock it down, and then treat that. So I would start with the Clear Digest, and if most people can tolerate it, so I wouldn't be afraid of taking HCl. All it's going to do, worst case scenario, is cause burning for a little bit. You're only taking it with your meal, and it's only going to cause burning for a few minutes. If worst case scenario. So I have been doing blood glucose monitoring first thing in the morning. My numbers have been 108 to 117. Okay, that's not good. So, I mean, I don't mean to scare you, but that's pre-diabetic. That's syndrome X. That's not where we want to be. So, and people will go, so, and you might be thinking this, how in the world I eat like this perfect diet? I don't eat any sugar. How in the world can I be pre-diabetic? Because it's not just your diet that can damage the cell membranes. So the reason why a person has elevated glucose, the reason why a person has type 2 diabetes is because the glucose can't get into the cell because the membranes of the cell are damaged and the receptors, the insulin receptors on the cell membranes are damaged. So what could cause that? Well, a poor diet could cause that. A poor diet, let's break it down to pieces. A poor diet eating way too much sugar over a period of time could cause that because it overstimulates the receptors on the insulin receptors on the cell membranes, and now the receptors just don't work very well. But that's not always the case. Some people have eaten a wonderful diet and they end up developing type 2 diabetes. Well, how is that? It can be because of other exposures to chemicals and things that affect and damage that receptor that isn't due to an excess sugar consumption. So that can damage the receptors on the cell membrane. And then lastly, that we're talking of type 2 diabetes. Of course, as type 1 diabetes, that's totally different. It's a completely different disease. So this is not type 1 diabetes. This is a diabetes, but this is pre-diabetic because your fasting blood glucose should be under 100. Now we want to get it down into the 70s. That's what we want to get it down to. So we got to look at, and everybody's an individual here. So if a person is like, I only weigh 106 pounds as it is, am I supposed to stop eating any carbohydrates? No. So there's certain things that trump getting our blood glucose down into the 70s. And one is that we don't want to put ourselves into a state of cachexia. So we have to be cognizant of that before we make that next decision. So maybe we should have a chat. My Ion ProWave folder has 4 foot bath programs. The shortest foot bath programs is, I know, some are 54 to 90 minutes. If I want to do a shorter program on occasion, can I use the one of the shorter ones that are already built in the computer? Yes, absolutely. So you could, it has an Ion ProWave folder that has about 40 different Ion ProWave programs in it. You can certainly pick a different one too. I have a UTI and tried to treat it with the Rife and the Manos, but it wasn't working. So I am now on nitrofuranol. Should I take a probiotic while I'm taking an antibiotic? The bottom line rule, just across the board, if you have to take an antibiotic, you should take a probiotic with it. You can take it with it and between doses also. So let's say if you're taking the antibiotic twice a day, once in the morning, let's say you take it at 9 o'clock and once in the evening, let's say you take it at 6 o'clock, you could take a probiotic at 9 o'clock, take a probiotic at 1 o'clock, and take another probiotic with your dose of antibiotic at 6 o'clock. There's been numerous studies that have come out that said if you take a probiotic, and it wasn't even specific to what type of probiotic. So just take whatever you have, just take a probiotic. Take a probiotic when you're taking the antibiotic. It was severe, it was a sharp decrease in gut damage and loss of microbiota if you take a probiotic with an antibiotic. So the answer is yes. What does metastasis to the bone pain feel like? Well, so it depends. If I have metastasis to the spine, I might not really have any pain whatsoever until there is a degree of bone loss that could cause a fracture. So when I have a fracture from caused from bone loss because of metastasis to that bone, that's called a pathological fracture. So it's not a fracture because I fell down the stairs. It's a fracture because it broke, because of lack of bone density, because of a lytic lesion in the case of metastasis. So a person may not have any bone pain with metastasis to the bone. A person may have bone pain. And if they do have bone pain, it would feel like a deep ache, a deep ache. Now, if it was a metastasis to the spine, and now you have pain because that vertebral body, let's say, fractured, then that fracture causes a decrease in height of the vertebral body, and you'll have pinching of the vertebral foramen, where the hole between the two vertebral bodies, two opposing vertebral bodies, the hole on each side where the spinal nerve exits from the spine, the foramen, the hole, the bony hole that nerve exits will be squashed, and you'll have pinching of the nerve, and that will cause pain, and that could cause pain wherever that nerve is going. So that would follow, that nerve. So just like if you had a disc that ruptured into the vertebral foramen and pinched the nerve, you'd have pain, with your lumbar spine, you'd have pain down your leg, or so it depends on where the fracture, where the bony metastasis is. Most bony metastasis, you won't have a lot of pain unless there's a fracture. So, and it goes in stages. So you'll have you won't just instantly have all this loss of bone and have a fracture. You'll have a loss of bone over time. And a bony metastasis takes time to develop. So you would probably have other signs and symptoms that would lead you to get an X-ray or to get a PET scan, because you're just not feeling good and your energy is down and fatigue, and something's wrong with me. I just don't feel well, and I'm losing weight. And then they do a PET scan, and you have metastasis to your 12th thoracic and your first lumbar and your 12th rib on the right. Well, you didn't have any pain in that area, but it was other signs and symptoms that brought you in to get tested, and that's why you ended up going and getting the PET scan. That was a 12-day prednisone pack. Sorry, left that off. Here. On prednisone again for sciatica and the iliac pain. Is it okay to still do coffee enemas, as they say caffeine not good with prednisone? Yeah, you should probably lay off the coffee enemas while you're doing prednisone. Now, you will absorb some caffeine. I mean, people will absorb different amounts of caffeine doing coffee enemas. Some people don't absorb any. Some people absorb more. And remember, there's that cytochrome P450 gene on your genetic test that if you have defects in that, you don't detoxify coffee very well. And if you don't have defects in that one gene, you detoxify coffee quite well. Caffeine, I mean, not coffee. So that would partly be a factor too. But you might want to lay off the coffee enemas for those 12 days. A dear friend of mine is not managing her diabetes very well, with sugars often around 300. That's not that uncommon with diabetes. Also, more recently, blood pressure issues over 200, over 70-ish. That's not good. Blood pressure meds make her dizzy and have other side effects, so not taking them as often as recommended. And really, the statistics on blood pressure medication, unfortunately, they really only bring the blood pressure down about 10 points. That's not very much. So there's other alternative functional things to do with that actually work much better. Do you have regimens you suggest on your site? Any suggestions on how to proceed? non-allopathic way. Granted diet for diabetes, but not sure how to proceed. I know there's a lot to ask, but it is very serious, and this person has to get very serious about their diet. So yeah, I don't think I have a whole lot about diabetes yet in the autoimmune course. I'm going to be adding a bunch of stuff about it. I do have a ton of stuff about heart disease in the blog. I have a whole series called Functional Cardiology that talks about heart disease. I think there's a series of 5 or 6 or 7 blogs about that go into depth about functional cardiology and what happens with your blood vessels and what you can do to help with that. I don't know if that would be helpful to her. Definitely, if she doesn't have cancer, she should be on a nitric oxide product. That would be the most helpful for her. That really wouldn't help with the diabetes, but it would help with the blood pressure. Diabetes is a difficult thing to manage because it's damaged cell membranes, and then cells that are reproducing, cells that have damaged cell membranes. And it's not an easy thing to fix. If her blood sugar is up around there, she probably does have to investigate, insulin as an intervention, because ultimately she's going to have glycolytic plaquing on her arteries. That's probably why she's got the high blood pressure, and glycolytic plaquing in her brain. And not to be scary and gloom and doom, but this is definitely what leads to early dementia. So both Parkinson's with its comorbidities and Alzheimer's. Alzheimer's has been suggested to be diabetes type 3 because it has so much tied to diabetes type 2. Rife brings it down 20 points, so that's encouraging. I will be adding a bunch of stuff in by this fall on diabetes in the chronic disease autoimmune course. I'm going to be just continue to add to that course. So you could look at that. This person can also do a case review with us and with me too, and I can help put together a protocol for her as well. So okay, any other questions? All right, well, thanks everybody for being on. And I will see you all next week. Now, I'm praying for you, and I love you all, and hope you're getting out and enjoying your summer. Bye-bye now.